Good afternoon. My name is Shatrell Lee, and today I will be presenting to you my community nursing presentation on wound, ostomy, and continence care nurses. Wound, ostomy, and continence nurses care for patients with wounds that have been caused by medical treatments, disease, or injuries. Wound, ostomy, and continence nurses provide post-surgery treatments and care for patients who have newly created ostomies. Oftentimes, these nurses work with healthcare teams assessing patients, managing as well as monitoring wounds for the healing process. Some of the primary activities that these nurses provide are wound care, treating and managing vascular ulcers, pressure ulcers, as well as diabetic ulcers. They also implement preventative measures to reduce incidence of skin breakdown, pressure ulcers, as well as vascular ulcers. In addition, they provide wound management, including reducing contributing factors, controlling odor, assessing nutritional needs, and providing treatment therapies. They also educate patients, family, and other support members on care techniques for wounds. They provide instructions on proper wound dressing, and they also educate patients, family, and other support members on ulcer prevention and treatment. In reference to ostomy care, they provide self-care, diet and lifestyle education, as well as support. They also assess stomacite to decrease and prevent long-term periostomal and stomal complication, which includes skin breakdown and pouch system problems. They provide education to families as well as patients on ostomy care, including preventing skin breakdown, pouch system maintenance, as well as diet. They also review and modify any pouch system problems that the patient may be having. In reference to incontinence care, they provide assistance in selecting and recommending any collection devices as well as any undergarments. They provide education and instruction on pelvic muscle exercises as well as self-catheterization. And they also educate patients, family, and other support members on hygiene and skincare. The scope of practice for wound, ostomy, and continence nurses is a multifaceted, evidence-based practice that incorporates a unique body of knowledge to enable nurses to provide excellence in prevention, health maintenance, therapeutic intervention, and rehabilitative and palliative nursing care to persons with select disorders of the gastrointestinal, genitourinary, and integumentary systems. Wound, ostomy, and continence nursing directs its efforts to improving the quality of care, life, and health of healthcare consumers with wounds, ostomy, and/or continence care needs. This complex nursing specialty encompasses the care of individuals of all ages, in all healthcare settings, and across the continuum of care. Some of the teaching and learning strategies that are used by these nurses include demonstrations, printed materials, simulation, use of the teach mnemonic, which includes tune in, which means listening to the patient before teaching, edit information, which means teaching necessary information first, act in each teaching moment, which means teach whenever possible, clarify often, which means make sure assumptions are correct, and honor the client as a partner, which means build on the client's experience. The educational preparation for becoming a wound, ostomy, and continence care nurse You must first hold a current, valid, registered nursing license, hold a bachelor's degree, fulfilled educational and clinical practice requirements including complete the Wound, Ostomy, and Continence Nursing Accreditation Nursing Program within 5 years prior to applying for the program, complete at least 50 contact hours or equivalent in a college work through a post-bachelor's degree for each of the specialty areas within 5 years for applying for the program, complete 1,500 clinical hours within 5 years of applying for the program. 375 of those hours must be completed within 1 year, within the last year. Sit for the certification exam within each of the 3 areas of the practice. And once you have completed those 3 exams, those 3 certification exams, as well as passed, you will become certified to be a wound, ostomy, and continence nurse. Some of the discipline and professionals that work along with these nurses are physicians, case managers, social workers, palliative care nurses, physical therapists, podiatrists, scientists, dietitians and nutritionists, as well as surgeons. Some of the additional skills and abilities that these nurses possess: they develop wound care treatment plans, comprehensive wound management, implementing preventive measures to reduce skin breakdown and pressure ulcers, vascular ulcers, as well as diabetic ulcers, assessing and managing post-surgical ostomy wounds, educating patients, family, and other support members regarding ulcer prevention, ostomy care, preventing skin breakdown, self-catheterization, hygiene, as well as skin care. In reference to wound, ostomy, and continence nursing, the interesting thing that I found doing my research about this field of nursing was the educational preparation that is required to obtain their certification, as well as the high demand for these nurses. These nurses work in a number of areas throughout the healthcare system. They are in a great demand, and these nurses and their demand continues to rise. I was unaware as well that these nurses provide incontinence care to patients as well. I'm glad that I did my research on this topic. I learned something new about another area of nursing. Thank you.